Hi there, I'm Dr. Mark Talbert. I'm a board certified general surgeon and I practice in Melbourne, Florida. And we are starting a YouTube channel centered around, at least initially centered around procedures. And some of these procedures are going to be in my office that we do under local anesthesia. Some of the procedures will be in the operating room. And the reason we're doing the channel is not to try to get in with all the other YouTube channels, but specifically for my practice, I have some novel approaches to things, and I have a lot of patients that ask if there's any YouTube videos that they could go watch to see how we do things. So this is part of patient education. This is part of an opportunity to let people see me work before they get something done. And to hopefully relieve some anxiety for them surrounding their procedures, because surgery can be scary. It's something that I do every day, but for the patient it's the first time or so that they're having something done, and so there's some nerves involved, and if we can make a video that shows them that they don't have anything to worry about, that these things go very smoothly 99.9% of the time, and provide them some relief of their anxiety. Maybe the OR day or the surgery day won't be as stressful for them. So this young lady has what's called a Pilar cyst. It's sort of like an inclusion cyst on the scalp, and it just kind of grows underneath the skin of the scalp, and we're getting ready to take that out. The trick here is to not shave the head, because long, beautiful hair doesn't need to be shaved. So what I try to do is we'll use some KY jelly to goo this hair out of the way. And surprisingly, you got some KY? Yeah. Surprisingly, there's very little risk of scalp infection, so the KY jelly doesn't get in the way of that at all. Just squirt some KY there and we'll get you all gooed up. The other part of it that I always warn patients about is the scalp has a tremendous blood supply, and it can bleed a lot. So I just have patients go home and shower right after the procedure to get all the KY goo and the blood out of the way. Better than shaving your head. Okay, here we go. So this is a stapler that will bring the skin together and actually prevent it from bleeding, so it's actually a good thing to use. Sometimes I can do a quick stitch on it, but okay, you all set? Yeah. All right, here we go. 1, 2, 3. I don't mean to cover it up from the camera, but these things will squirt you in the eyeball. Ooh. There we go. Okay. So like every cyst has a sac, a wall, that if you don't get the whole sac out, the cyst will come back. And trying to get this cyst out without rupturing It's a little tricky. Okay. And that's what an inclusion cyst looks like. You want to see it before I drop it in there?
Yeah. Neato.
Great, man. Great stuff. Awesome. Yeah.
I guess you have to do this for a living to get excited about stuff. Oh my gosh, that's funny.
It took me till the other day to stop thinking you're like, zip it.
I've had it done before, though.
I went nice like that.
I think it's awesome.
All right, so in 2 weeks, come back and we will take those staples right out.
Okay.
And it looks great. So thank you for watching the video, and I hope you learned something from it. Hope it relieved a little bit of anxiety if you're about to have that particular procedure done. I love answering questions. I never consider that an issue. So feel free, if something seems amiss or you have questions about things specifically, feel free to contact the office. Our office number is 321-372-1372, and I'm Dr. Mark Talbert, and I hope you have a good day.